Hi everyone, I'm Dr. Kristen Giller and I'm here to answer your burning COVID questions. Thank you to everyone who posted questions on our website. Hopefully I can get through as many of them as possible today. I'm at home right now with my little guys. We hope that you're all doing okay in your own homes and adjusting to this strange new reality that we're living in right now. So without further ado, we'll get to some of the questions. So a lot of these are sort of situational. They're people who have got questions mostly about self-isolation, but a few other things as well. So I'll try to zip through them and maybe combine a few because they have similar answers. The first is about a mom who's with a group of ladies last week. Today, one of those ladies was put in quarantine by her doctor as she had just returned from a cruise. Should my mom now quarantine herself? Also, I've been in close contact with my mom, as has my daughter, since she was around the lady who was quarantined. Do we all need to quarantine ourselves? The lady who was quarantined has not been tested. She does not have symptoms, but she does have a lot of health issues and is generally not super well. So her doctor placed her in quarantine more as a precaution. So it sounds like this woman is mostly in the 14-day self-isolation period that everyone is in after returning home from travel. As long as she doesn't have any symptoms, even though her quarantine was delayed by a couple of days, you should all be fine just to self-monitor. So you don't need to quarantine yourselves, but I would monitor closely for symptoms. So you're watching for fever, cough, other respiratory symptoms, generally feeling unwell. If you were to get any symptoms, we'd encourage you to seek advice and to self-isolate as soon as possible. Okay, so the next question is about a daughter who works in HR in a manufacturing plant, and a person working in a different part of the building came down with COVID-19. Should my daughter self-isolate? So the most common way that this virus is transmitted is through direct contact with a person who is positive. That could be a person who doesn't have any symptoms, who is in the sort of 24 to 48 hours before developing symptoms. It could be somebody who is asymptomatic and has the virus, but still direct contact for sort of more than 10 minutes is the most common way that the virus is transmitted from person to person. So if your daughter works in a different part of the plant and wouldn't have had direct contact with this person who tested positive, then she does not need to self-isolate, even though she worked in the same building. If they were working sort of in the same room without direct contact, but they would have contacted the same surfaces multiple times, the same doorknobs multiple times, then that might be a bit of a different case. But if it was a large plant and she worked in a different part of the plant, then she's fine just to self-monitor without needing to self-isolate. Next one, and we've had this similar question a couple of times. It's a tricky one. We understand where people are coming from when they post these questions, and we just want to thank people for being so thoughtful and cautious with these types of situations, because we know that they are difficult and they involve a lot of emotion, and so we just want to thank you for taking the time to ask these questions and to think these things through. My son wants to see his girlfriend, and she wants to see him, obviously. So far, neither we nor the girlfriend's parents have let this happen. Is it safe to have his girlfriend come over to our house or to have him go to her house so that they can see each other? I'm sorry the question seems trivial, but we just want to do the right thing and keep everyone safe. So this is the furthest thing from a trivial question. This is the difficult one that many of us are facing right now in terms of, can we visit our extended families? Can we visit people who mean a lot to us, who we really want to see? I'm afraid that the answer isn't an easy one, but the safest thing to do would be to keep your contacts within your own household. So we kind of need to consider our households our inner circle, and try to keep that circle as closed as possible. So that means oftentimes grandkids not seeing grandparents, girlfriends not seeing boyfriends, because once we connect these households, it just creates that many more contacts that could potentially bring the virus in, and many more contacts if somebody does become positive that could then disperse the virus out into the greater community. So it's not a popular answer and a very difficult one to give, but the safest thing to do would be not to let them have face-to-face contact. People are getting very creative with these types of situations, so Skype dates, FaceTime, going for walks at a very safe 2-meter distance from each other, and not being lax about this. The difficult thing about seeing each other in person is it's so difficult to maintain that 2-meter distance when you go for walks, when you go out. So if you do decide to do that, you have to be very, very careful about it. But that's the general rule. So just keep your 2-meter distance. If anyone is sick, they 100% stay home, and then try to find other ways to stay in touch other than face-to-face. Can you again outline the recommendations for children and playing, i.e. outside, not on play structures, keep your distance, etc.? So being a mom of 2 young, very busy boys, I totally get this, and I really feel that getting them outside is critical to all of our well-being right now. So get outside, for sure, get outside. If you can do it in your own backyard, that's obviously the safest, but our backyards start to feel fairly small and closed in over time, so getting out in the greater community is helpful. If you have younger kids, keeping them in a stroller, going for a walk or run. If you have older kids, get them on the balance bike, get them on their bicycles, and just keep them moving. You really can't have play dates with other kids. Unfortunately, young kids especially just don't have the self-regulatory skills to be able to keep their distance from each other. So if you get them together, they're going to cross those boundaries, and it's too much to ask of them to follow those rules. So with the really young kids, I would say avoid play dates if you can. Try to do things virtually as much as you can. With kids being older, you can maybe get a little bit more creative, and I got an idea from another one of our physicians that she set up a badminton net so that her kids can play badminton with the neighbors' kids. So they all go outside, the neighbors' kids have their own rackets, her kids have their own rackets, they keep their safe distance, but they still get that social contact. Recognizing that this may last a fairly long time, it's important to find creative ways that our kids can still have social contact, because it becomes very strange for them otherwise. But yeah, parents are probably going to need to get out and play a lot with your own kids. I'm having friends saying to quarantine our groceries, right? What are best practices for grocery shopping? Should we soak products in a vinegar solution prior to eating? Do we need to wipe down packages before opening? So again, there's a lot of gray area here. I just want to reiterate that the most common way that the virus is transmitted is by direct contact with other people, but we can also pick it up from commonly contacted surfaces. So that would be things like doorknobs and faucets and any handles that many people might be touching. Those are areas you need to be really, really cautious of when you're out in public. If you do go to the grocery store, you got to work really hard to keep your 2-meter distance from the people around you. But then it comes down to contacting the things that you have to pick up off the shelves. Nobody can 100% guarantee that you're not going to pick something up from those things. Boxed goods on the shelf are probably reasonably safe. Do I think you need to wipe them down when you get home? I think that's a judgment call that each individual family will have to make, but it's certainly not a blanket recommendation. If you live with somebody who is immunocompromised or quite elderly, it might be something that you consider doing. If you have a young, healthy family, it may not be something that you need to do 100%. Washing produce, always a good practice no matter what, even before COVID. But for COVID in particular, vinegar is not going to kill the virus, so if you're doing it for COVID, just a soap in water is probably your best bet. So just wash in soapy water and then rinse well, and then you should be safe. There's another one here about a 17-year-old who's had some issues with croup as a younger kid, takes puffers when he gets colds, and mom is concerned that he may be at risk for complications if he gets COVID. So it's a good question. We're certainly hearing a lot about lung disease and underlying medical conditions putting you at higher risk of complications if you get COVID. These things are definitely true, but more so for older patients. I mean, the data is still evolving, but from the countries that we've seen with the most number of cases, we've got pretty good evidence that COVID doesn't cause serious illness in younger people. The data coming out of Korea showed that there were no deaths at all in the under 40 population. And data out of China was showing there was only 1 death in the 10 to 19 population and none under the age of 10. So as far as we know, children still do get infected, but their illness is often mild. And I think your son would not be considered to be at high risk based on his history. Are there any COVID-19 cases in Uxbridge? This is a question that we got multiple times, and understandably so. It's something that's sort of in the back of all of our minds, sort of wondering when the cases are going to start to come and when things are going to start to evolve. We at this time have not had any confirmed positive swabs in Uxbridge residents. There have been a couple of cases that have been suspicious. We've gotten a lot of phone calls of people with symptoms. There are many people with mild to moderate respiratory symptoms that we're just not testing. So we are assuming that it is around, but at this point we don't have any confirmed positive swabs. Okay, we returned from Florida. We are doing a 14-day self-isolation. We have been outside to go on walks on the Uxbridge trails. We perhaps see a couple of hikers on our trip and we keep our distance. We do not want to compromise anyone. We're feeling well and healthy. Is this routine acceptable? So thank you for your caution. All of these questions are really wonderful because it just shows that people are really thinking this through, and we really do appreciate that. I understand being stuck in your home for 14 days can be really uncomfortable. So getting out for walks does make a big difference. So as long as you are going on the trails, and if you do contact anyone, that you're keeping your safe 2-meter distance, even turning your back so that when you pass each other, you're going back to back instead of face to face, then you should be quite safe. But do follow those guidelines. Don't feel silly about it. We're all doing the same thing. It's very bizarre, feels very strange, but it's incredibly important. So if you are out walking and you're on a 14-day self-isolation, this is more for those people who don't have symptoms and have returned from travel. If you have symptoms, you shouldn't be out at all. So if you've got symptoms, you need to stay home, you need to get things delivered. Don't have any direct contact with anyone else unless you're needing to get into the hospital to get assessed. That really should be the only reason that you're leaving the house, if you have symptoms. All right. My husband was feeling a bit lightheaded. He said he was feeling kind of woozy for a couple of days. He's 70. He had no temperature and no other symptoms. He stayed in the basement. Should we still be staying in separate areas now that he's feeling better? So it sounds like he was sick for around 36 hours, mostly just feeling a little lightheaded, no other symptoms, and wife is wondering if they should be staying in separate areas. She's also 65, works in a doctor's office a couple of days a week, and is wondering if, since she's in the high-risk group, based on her age, if she should return to work. So with respect to your husband, just feeling lightheaded for a couple of days, I wouldn't worry that he's been infected with COVID. At the age of 70, you would expect, if he did get an infection, he'd be getting respiratory symptoms, probably a fever, but just feeling lightheaded, I wouldn't consider typical symptoms of COVID. It's good that you isolated yourselves from each other, but now that he's better, I wouldn't be concerned. In terms of your job, most of our clinics are moving towards telemedicine, so we're doing most of our work remotely. Many of us are working from home, calling patients in the evenings. Child's distracting me from the window. So yeah, I think probably in your office you're noticing that there aren't many people there anyway. So you're probably quite safe to be there, but I would just have that discussion with your clinic manager and just make sure you're feeling safe yourself to be there. That's definitely a discussion worth having. Okay, very helpful first video from Dr. Jensen. I have a follow-up question for her from the scenario about grandma babysitting. Wouldn't she be at risk from the parents who go to work and therefore have more exposures? But a further answer would be appreciated. Also, one more scenario, our teenage son wants to be with his girlfriend. I think we've addressed that one. So I'll deal with the grandma babysitting scenario. It's another tricky one, and honestly, we all sort of have to make the best decisions we can given the circumstances. The guidelines would be keep your inner circle as small as possible. Only the people who are living in your house are the people that you have direct contact with. But in some cases, both parents are working outside of the home in essential services, need to leave the home, and need to have somebody caring for their kids. So as to who that would be, we sort of have to leave that in your hands. Grandparents are at higher risk. So if parents are working outside of the home and bringing bugs back, I would be more worried about the viruses that the parents are bringing home than what the kids might be giving to grandma, as they probably aren't leaving the home much. If you're all there together, you're all sort of isolating together, keeping your social distance, and you have grandma already living in, or you want to bring grandma to live in, I don't think that's unreasonable, as long as everyone's being very careful when you do go out in public to be very strict with social distancing. Hopefully that answers your question. Certainly, I mean, if grandparents were over the age of 65 or over the age of 60 and unwell, I would maybe take more caution in those circumstances. But you kind of have to make these decisions on a case-by-case basis. So we just read some news about the use of hydroxychloroquine with or without azithromycin to treat COVID-19. What are your thoughts? I think all I'll say about this is that the use of these two drugs is still considered experimental. It is true that some hospitals are having success in more severe patients with COVID-19 who are admitted to hospital. The combination of these two drugs has some serious potential side effects, one of which is an abnormal rhythm in the heart. So it's certainly not something that's recommended for blanket use in all cases of COVID-19. It's not something I don't think that will ever be recommended for mild to moderate cases, but at the present time it is being used experimentally in more severe cases of admitted patients. All right, I think this is our last one. We traveled abroad internationally and were asymptomatic the entire time, including now. We are currently self-quarantined for 14 days as directed by Health Canada. I will be returning to work on March 31st. My company allows the wearing of a mask. Do I need to do this, or is a mask ineffective as PPE for an asymptomatic person such as myself? You have only given guidance as to donning a mask if you experience symptoms. Thank you. So, very interesting question, and honestly, the advice around this is constantly evolving. At present time, in the hospital and in our clinics, we are putting masks on everyone. And the reason for this is that while we feel well now, we could be asymptomatic carriers, or we could be in that 24 to 48 hour period prior to developing symptoms where we are shedding viral cells. So the purpose of wearing a mask, both patients and healthcare professionals that you might see in the hospital or in a clinic, is to protect the people, is to protect other people. So the mask does more to prevent you from spreading the virus than it does to prevent you from getting it. And the real risk of wearing it in terms of you getting the virus is that it involves a lot of face touching. So putting the mask on and taking the mask off sort of puts you at risk of contaminating yourself. That's really the main concern. So it does protect you from viruses coming into your airways. It doesn't protect your eyes, which is another route that the virus might get in. And it might give you a bit of a false sense of security in terms of being protected out in public spaces. So at this time, I'd say the main reason to wear a mask would be to prevent asymptomatic spread, or to prevent spread if you did have respiratory symptoms. So that is all. Thank you very much for your questions. Keep them coming, and we hope that you all keep well.